This
I've been there. It's
conference will
actually
now be recorded.
it's actually really cool at Benco if you haven't been there. And keep in mind on that Friday, the 27th, there's a welcome reception at the Mohegan, and that's one of my favorite things because you get to talk to people, bend some ears, and meet people. So if you're available on the 27th, the Friday to go, I'll be there, and some of us will be there, so you won't be by yourself, essentially. So our presentation tonight is on ethics, and why is this important? I just wanted to share, just a brief intro on that. Essentially, more people need to step up, and I'm sure you've seen on social media, we really need ethical people. I don't want to say speaking out about ethics, but kind of speaking up when needed. And because quite frankly, we were talking about this before, there's a lot of bad advice being given on social media outlets. So we need people, ethical people, to step up when advice like this is given, especially to new dentists. I see it a lot. So that's just an essential key to this presentation. And as we all know, bad ethics is bad for our profession, which, by the way, is a profession that at times isn't painted in a great light publicly, especially when it comes to dealing with finances, dealing with patients, etc. So, welcome everybody. We can go to the next slide. I just wanted to start off with just some background. The ADA was founded in 1859, and then the first constitution and bylaws were adopted in 1860. So guess what? This has been around for a long time. Since the ADA is the largest and oldest dental organization, do you think it's important that the ADA kind of sets the standard for ethics? It's huge that our organization, the ADA, if anything, behaves in an ethical manner. Hence, in 1866, the ADA adopted its own first code of ethics. So in 2016, we even marked the 150th anniversary of the code, which summed up into three short words involves putting patients first. So the core principles have been the same for all these years. So really important there. So with that being said, I give you Linda Himmelberger.
Thank you, Seth. And I would like to emphasize that the ADA Code of Ethics was the first code that was adopted by any professional organization. We had a code of ethics before the physicians, before the nurses, before podiatrists. Name a medical profession. We were the first to have a code of ethics, which I think, I always point to with some pride. So, Sarah, can we bring up the next video? I know Sarah has to turn the sound up really loud on this. The ADA has a public facing side to their website called mouthhealthy.org. And there's great information on there. And when I was in practice, the young woman who was helping me get content for my website came across this little cartoon about dental ethics, which we then posted on my office website. And I cannot tell you how many times patients commented on ethics and dentistry and how important that was in making a choice to find their dentist. So, Sarah, if we can hit play and see if everybody can hear what this little video has to say. And turn the sound up way loud. That's the same. Sarah did promise me that even if we can't hear the video, that you can go on to the recording and that you'll be able to hear this little presentation. This
Sarah, I think
video
you have
does.
to go off of mute. Sarah's on mute. I think she has to unmute herself for this volume, right?
One of the things I like about.
And referring you to a specialist when necessary.
There you go.
The American Dental Association is America's leading advocate for oral health. What does that mean exactly? It means that when it comes to choosing a dentist, most people choose an ADA member. And that's because people appreciate the patient-first promise that ADA dentists make as part of the association's code of ethics. What are those promises? It starts with respect for your wants and needs, which means that as a patient, you have the right to be involved in decisions about your treatment and to expect privacy and confidentiality. They promise to do no harm. Your dentist's duty is to keep you safe and healthy. Part of this is keeping his or her knowledge and skills up to date and referring you to a specialist when necessary. They also promise to do good, which may sound a lot like do no harm, but it means your dentist will provide high quality and timely treatment while considering your needs, wants, and values. They promise to be fair. Your dentist does not discriminate and will provide dental care without prejudice. And they promise to be truthful, because everyone wants a dentist they can trust. So you can expect to have a great doctor-patient partnership. To learn more about the ADA's Code of Ethics or to find an ADA dentist, visit mouthhealthy.org/ADA member.
Thank you, Sarah. I'm glad we got that working. I I think that's a really very patient accessible explanation of our code. We're going to go through tonight and talk about the various aspects of the code and use the big terms for those different areas of respect and do no harm. But I would also encourage you to think about maybe adding that little video to your website. And I think you'll be pleasantly surprised at how it resonates with the patients. So now I'd like to turn the program over to Dr. Gary Davis, who's going to talk a little bit about why we talk about ethics.
So yeah, I'm the, begin with why, right? And Linda asked me, do you want to have a slide on why of ethics? And Seth talked about it a little bit earlier, but life is just becoming more confusing, more abstract, more complex. There's a lot of issues out there. There's debt, there's stress. We have social media. People feel strongly about politics, and so we have conflicts in dental offices about patients and maybe some staff members talking about political things in the office, and what are the ethics behind that. So our the culture is just becoming more confusing, so we really need some kind of guidance and process on how to make difficult decisions when we're faced with these challenging dilemmas. And I'm glad to say that the ADA and PDA, we have the tools to help you. We have the code, and I think at the first meeting everybody got the manual. But just having a code of ethics and a principles of ethics and a code of professional conduct, doesn't create an ethical culture in the ADA or PDA. It's a good start, and just having a class today is a good start. But what we really need to do is we want you to take the information that you get today and aligning it with everything that you do, in your office, within the ADA, within the PDA, and within your local. Just kind of constantly ask yourself and others, are we doing the right thing? Is this the best thing for the association? Is this the best thing for the patients that we're treating? So that's the why of ethics. Next slide, please. And if anybody has questions while I'm talking, just, you can write a note in the chat there if you want to, or there's a react button if you want to raise your hand, and Linda can call on you. So the very beginning of the principles of ethics, it has a preamble, and it says that our dental profession has a special position of trust with society, and we do. Patients, tell us everything, right? Sometimes things that we don't want to know, they tell us, and it's important in order to treat them correctly and safely. They need to trust us, and they give us special privileges. But in return, we have to, as dentists, as professionals, make a commitment to society that will adhere to very high ethical standards of conduct. And if we want to continue to have that trust, right, we have to be committed. Every dentist has to be committed to high ethical standards of conduct. And I don't know if you know, but when you sign up for the ADA, you make a pledge that you will follow the ADA code. And the ADA code has 3 components. It has the principle of ethics. There's 5 of them. And that video, was just, went over them very quickly. And then there's a code of professional conduct part of it that talks about, okay, this is the principle. What does that mean in my office? Give me some examples of that. And then there's some advisory opinions, because every so often the council that I'm about to leave, called CEBJA, Council of Ethics Bylaws, sometimes we get questions. And what about this? What if someone does come into my office and they're talking politics? What can I do? What should I do? Or what if someone in my community is advertising and I don't think they're doing it, the correct way, or in an ethical manner? What can I do? And so sometimes we give advisory opinions, and sometimes we even write white papers on things, like social media. We actually have a white paper on social media. So next one. Next slide. Yeah. And so I think, Linda, you want to start talking about the first principle, which is autonomy.
Yes, and in that little video, it referred to autonomy as respect for the patient. And the definition of autonomy is self-governance. And what that says is that the dentist has an obligation to treat the patient according to what the patient desires, as long as it's within the bounds of acceptable treatment. So in other words, there really is more than one way to skin a cat. Sorry for those of you who are cat lovers on this video. But we need to be able to present a variety of treatment options to patients, let them know the pros and the cons of each one of those treatments that we're recommending. And oftentimes, maybe no treatment is also an option. It might not be the best treatment. It might not be a desirable treatment, but we need to let the patient know, sometimes just letting something go is okay in a short term. But you really do want to make sure that you're having a conversation with the patient, that it's a two-way give and take as you're discussing potential treatment in any given situation. Again, we want to inform the patient of any reasonable alternatives. Clearly, if somebody comes in and they have a small chip out of their front tooth and they say, I want this tooth extracted, probably not a reasonable alternative. But then it's up to us to make sure that we educate the patient and help them to understand what a better treatment would be in that particular situation. Autonomy also obligates us to safeguard the patient's confidentiality. And I think we all know intuitively that we don't go to a cocktail party or a PTA meeting and say, I treated the principal today and she needed a root canal, or, I did a crown on that individual over there. You'd never know it. Look how well it blends in with the rest of their front teeth. We would never do that. I think we all know that talking about a patient to others outside the office is really off limits. But we do need to be careful about patient records as well. And I'll share with you, an associate in my office saw a patient, wasn't quite sure about whether or not there might have been a periapical area, and called up the local endodontist, shared the x-ray, and then called the patient and said, I talked to the endodontist today, and the patient went ballistic. What do you mean you talked to somebody else about my treatment? You never told me that you were going to ask somebody else about me. You didn't have my permission to share those records. So we need to be really cognizant of the fact, particularly in this day and age, always, always say to the patient, I'd like to maybe get another opinion on this. Is it okay if I share your x-ray? Is it okay if I talk to somebody else about this? So that we really are making sure that we safeguard patient confidentiality. Don't leave computer screens up that show somebody else's treatment when somebody else is coming into the operatory. Be aware that we need to safeguard these records. The other aspect of this autonomy that I see used and abused on social media is the issue of furnishing copies of records. Do you have to supply copies of records to another dentist? And the answer, short and long, is yes, absolutely. Um, you'll see on social media, sometimes people will say, well, the patient didn't pay me. Can I withhold the records until I get payment? Ethically, no, you may not withhold the records. And legally, you may not withhold the records. We've put a reference in here to the Dental Practice Act, section 33.209, subparagraph C, that says you must furnish copies of the records within 30 days of receiving a written notice, and that you may charge a nominal fee for reproducing whatever records that you might have. In this day and age when so many things are digital, I think really the cost of reproducing records has more to do with the staff time than it does with making Xerox copies and duplicating x-rays. But regardless, you may not withhold records. You may not hold the records hostage and tell the patient that no, you're not going to release them until you're paid. So regardless of what you might see on social media, what kind of bluster and bravado, you are obligated to furnish records, and at a nominal charge. Next slide, please, if we could. Any questions about autonomy? Okay, now we're going to go on to a principle that that I cannot pronounce, but it's called, in my best efforts, non-maleficence. Do no harm. So we have, as dentists, an obligation to protect the patient from harm. And harm has a very wide-ranging definition under this particular principle. Certainly we don't want to harm the patient by doing something iatrogenic, like dropping a sharp instrument or cutting them, cutting their gums, cutting their tongue, cutting their cheeks. We need to be careful, obviously, about that sort of thing. But in order to help to prevent us from doing harm to a patient, it's very important that we keep our skills current. In other words, continue education, continue education, continue education. In Pennsylvania, dentists are required to receive 30 core hours. I know there are other add-ons with child abuse and opioids, but we are committed to 30 hours of CE. And there has been some consternation in the past that courses in practice management do not qualify as CE in order to renew your license in Pennsylvania. Courses that will satisfy your CE requirements for licensure renewal in Pennsylvania are all clinical skills, clinical based. And that goes back to this do no harm, keep your skills current. We're focusing on the clinical skills. If you think you're in over your head, seek a consultation, refer to a specialist. I personally never did a endodontic procedure on a distally tilted maxillary third molar. If that's your thing, great. But remember that when you do a procedure, you have to do it to the skills of a specialist, not what another general dentist might do, but what a specialist would do. And a word to the specialists. Specialists are obligated to return your patient to you. So the only exception to that is if a patient comes to their office self-referred, had no general dentist to refer them, or if the patient says to the specialist, I'm not going back there. I don't want to go back there. then the specialist can refer to another practitioner. But otherwise, ethical specialists will return your patient to you. Also under this category of do no harm, I would hope that anybody who finds themselves in a situation where they are impaired, whether it's through drug or alcohol abuse, misuse, whether it's because of a medical condition, you really need to get help, because you can do great harm to a patient if you are providing care while you are impaired. Equally, if you know of a colleague who is impaired, it is your obligation to report that patient. Now, you don't have to report them to the dental board, but you do need to contact the Pennsylvania Dental Association, and the folks there can help you get that patient to the treatment that they need. But you cannot ethically turn a blind eye knowing that one of your colleagues is having trouble. The next one, use of auxiliary personnel. You need to know the scope of practice of the auxiliary personnel in your office. What an EFTA can or cannot do, what a hygienist can or cannot do, what level of supervision a hygienist needs depending on the health status of the patient, the practice location. And again, another post-exposure. If you know that, you've stuck yourself with the patient, after you've given an injection, you need to be sure you have protocols in place. You need to be sure to let the patient know if you've stuck yourself and then transferred that to the oral cavity. So be sure you have those processes and procedures in place. Another sticky wicket for a lot of patients is patient abandonment. Even there are many circumstances where you may want to ask a patient to find another practitioner. You need to be sure that before you dismiss that patient from your practice, that they are not in a precarious position. So if you have temporaries placed, you need to be sure that they are well cemented. You need to give the patient an opportunity. Here are names of some of my colleagues. Maybe you'll have a better experience with those, with my colleague, than you're having with me. And then last but not least, having personal relationships with patients, unless you are married to them or cohabitating with them, is a very big red flag. If you want to lose your license and not be able to practice again for a minimum of 5 years, begin a personal relationship with one of your patients. Guaranteed, surefire way to have your license revoked. Anybody have any questions? And I would also say with that patient abandonment, always check with your malpractice carrier before you let a patient go. They can help you with the wording to be sure that you do that in a way that will not get you in trouble going forward. Okay, not seeing any hands anywhere. Let's go on to the next slide. And Gary, I think that's your turn.
Sure. So next, the third principle is beneficence. I think I said that right? And basically, this principle expresses the concept that professionals have the duty to act for the benefit of others, right? The patient's welfare first. And there's many parts of that, but it's, if I have a tea time at 4 o'clock and I have a patient with an emergency that's in the office, I have the duty to act for the benefit of the others, of the patient, right? And not to say, well, sorry, you're going to have to come back another time because I have a tea time. So I mean, it's not saying your whole life has to be spent 24 hours a day treating patients, but that's one of the pledges, or one of the ethical codes that you agree to, is to do good for your patients. One part of that is community service. So since we have the obligation to use our skills and our knowledge and our experience for the improvement of dental health and for the good of the public, we're encouraged to be leaders in our community and to I lost everybody's picture. That's what's happened, but to help others, especially when it comes during a public health emergency. It's really important for us. That's one of the advisory opinions, that we are supposed to act in the benefit of society. Another part of doing good is self-regulation. I talked about that in the very beginning in our preamble. Every profession owes society the responsibility to regulate itself. And it's mainly through societies, right? Through our professional society that we kind of regulate ourselves. So all dentists have the dual obligation of making themselves part of the society and observing the rules of ethics. That's part of being self-regulated. The next part in doing good is in research and development and patents and copyright, right? So we have the obligation of making the results of any research that we do public for the good of others. And if we do have a patent or copyright on anything, we cannot restrict it, right? We have that right to have a copyright, but we can't restrict research or practice of anything that we do or that we invent or produce, if it's going to not help others. So that's the part on patents and copyright. So, and then of course, the next part of doing good is being aware, getting education, being aware of abuse and neglect. As you all know, we are all mandatory reporters, right? So we have a responsibility to report if there's abuse out there, and that is a tough issue for many people, and many staff members will, come to you, and it's a judgment call. Is that mother abusing that child if that child has several cavities, or doesn't want to do the caries in the primary teeth, but only wants to take care of the adult teeth? So I mean, you need to have discussions with people and not judge people, but we do have to report any kind of abuse or neglect. And then the last part of doing good is just your professional demeanor. I mean, the way we work with others affects, how well the treatment is for the patient. So Linda was talking about working with specialists. If you're a general dentist and you refer out to specialists and you don't have a good relationship with some of the specialists, then you need to get on the phone, or if there's an issue, you need to get on the phone, because it's very important for you to communicate information you have about the patient, and it's very important for the specialist to report any information they have about the patient if they get the okay from the patient for you guys to share it. And when you refer, they're saying, yeah, okay, give them the information. So any comments on that? Because that whole area of abuse and professional demeanor is something that some people have issues with, but it's an extremely important part of what we do and how well the patient is treated. We're good on that? All right, let's go on to the fourth principle, which in the video Linda showed in the beginning was fairness, but it's justice. And we just basically have the duty to, treat people fairly. And in so many ways, duty to be fair in dealings with patients, dealings with your colleagues, dealings in the community. First thing we can't do is we can't discriminate. So patient selection is one of the first code of professional conduct items in there. So we cannot refuse to accept patients into your practice or deny services based on a patient's race, creed, color, gender, sexual orientation, gender identity, national origin, or any disability. And there is a section in there, and came in years ago, with bloodborne pathogens. So if you feel like you don't have the skills or ability to treat someone, then you have the duty to refer, but you cannot just refuse to treat someone, if you do have the ability to treat, and you just say, oh, well, that person has a disability, so I don't want to treat that person. The next thing that's really important that we talk about a lot is emergencies. We get this question a lot in the PDA. And so if the patient of record is a pretty easy one. If you have a patient of record, we're obligated to make a reasonable arrangement for the emergency care for them. But then the question comes, well, what about, patients not of record? Okay, and that's a very controversial thing because, a lot of dentists will say, I don't want to go into the office alone, with a new patient I don't know, or and basically, and Linda and I we were talking about this earlier, but you need to make some kind of reasonable arrangement, even for, a person not of record. I don't know if Linda, do you want to speak to that some more?
Sure. According to our code of ethics, um, if somebody calls you out of the clear blue, not a patient of record, you don't know, maybe they're drug seeking, you really don't want to go into the office after hours, you still need to reach out to them, and if it means referring them to the emergency room or one of these urgent care facilities, or giving them the name of an oral surgeon, but you can't just ignore them. You can't just say, I'm not going to be bothered with them. And I think over time, experience sort of teaches you which patients may be drug seeking and which ones may be legitimate. But I know social media is rife with, again, bluster and bravado and saying, no, I don't, ignore them. They're not my problem. Maybe they're not going to be your problem long term, but when they reach out to you as a professional, you are obligated to take care of them. And I'll tell you one other little story. The Wednesday afternoon before Thanksgiving, this past November, I was getting ready to leave my house, and I smelled a really bad smell. Smelled like burning plastic. And I opened up the closet where my um, breaker box is, and it was hot. It was not warm, it was hot. And I was concerned my house was going to burn down. And I started Googling electricians near you as fast as I could make my little thumbs move. And I called several electricians. And the one who said, yes, I will be there and I will help you, on the Thursday afternoon before Thanksgiving, $15,000 later, my house was rewired. But, if I need a light bulb changed, I call that electrician. I have um, a new light I need to have hung. I call that electrician. And, we talk about being professionals and being tradespeople. That man was a professional. He came when I needed him the Wednesday before Thanksgiving, and saved my house. I am sure that he saved my house. So people are grateful when you reach out to help them. Sorry, Gary, didn't mean to go on.
No, you're good. I think that's exactly what the Leadership Academy people want to hear is, stories, examples. I think that's really good. I think Jay has a question too, or a comment. Go ahead. You got to unmute yourself. Unmute yourself.
I just did. So my question is, and I've always been, this is the way I treat, but I'm not sure, but isn't it our obligation to address the patient's chief complaint always? If they come in for cavity on the upper right second premolar, but you see an abscess on the upper left, I've always addressed the patient's chief complaint, and I will tell them about the other issue. But if they say it doesn't bother me, I don't want to do anything about it. I just document it and move on. Now, is that appropriate? Isn't that appropriate or not?
Yes.
Absolutely.
As long as you
Absolutely.
inform, I mean, you have to educate the patient, inform them that, this is an abscess and this could, lead to X, Y, and Z, and I know you just want to take care of this front tooth right now, and I'm willing to do that if that's your chief complaint, but you need to know that this tooth could abscess at any time and could, cause a toothache, or you may lose the tooth down the line if you don't get it treated soon. So I think that's very appropriate. What do you think, Linda?
No, I absolutely agree. Um, it's all about educating, informing, and letting the patient know what else they may need in the future.
And then documenting it.
Oh yeah.
Oh,
Yeah, you have to
document it.
document. Yeah.
Thank you.
Yep. Any other questions on that subject? All right, so another example of fairness is the section in the code that talks about justifiable criticism. I was really impressed with the comments made on the social media, sites about justifiable criticism, and that sometimes you get patients from other doctors, and it may not be the high quality you think it should be, or not the nice margins on the crowns or the restoration that they have. But you never know until you get into the mouth of the patient and see all the issues that you have to deal with. But you do have the duty to inform a patient about their oral health, and without disparaging the previous dentist. So you might feel like, oh, this isn't the greatest thing, but and they might have just had a crown done on tooth number 14. I just had that done last year, and instead of putting down the other doctor, you just need to talk to them about well, this is the issue, and just kind of educate them and talk to them about that. I see two hands. I see that and Jay. So that, you want to go first?
Yeah, I think it's Jay's the previous question, but mine's like I just have it today, and it's like I just want to know, like, from you guys' experience, how do you address that with the patient? Because, like, in my office, I saw it today. That's like on the X-ray. I asked the patient, like, do you feel any problem at all in your mouth? He said no. Like, you've been coming here for like 25 years. I don't have any issue. But there's like two teeth that's like very close. I have decays very close to the nerve and need root canals and crown. And I didn't know what to say because the patient just the previous doctor, and I don't want to hurt the patient either. So it's like, yeah, you have very deep feelings, but I didn't want to tell him that he might need root canals. And so, like, from you guys' experience, how should I address that?
So I just want to be clear. So you saw a patient that another doctor in your practice, or a practice that you bought, I guess, treated, and there was decay close to the nerve. And did you treat it today or not?
No, I did not. But I
That
tell him that's
means,
like, you need at least like some feelings, and we go from there.
yeah,
But
right.
like, they've been there for 25 years, and like for the last 3 or 5 years, there's no issue because we don't have bite wings. But now I took bite wings and I see problems. But
Okay.
they
I was
just
going to say, was there previous bite wings? Especially if there's previous bite wings, and if
yeah,
the patient asks, I think you have to be honest. You don't want to
yeah,
disparage another
right,
dentist, right?
yeah,
But there weren't bite wings. That's what you're saying, right? And then you saw the
yeah,
decay, and I just think you just have to be honest and
right,
say, this is what I see now. I don't know what that tooth was like 2 years ago, but I know what it's like right now. And you're, there's a good chance that you're gonna, need a root canal. I just want you to know that ahead of time.
yeah,
And
Linda?
you can always say that, the position of the decay, you couldn't see it just from the exam, just from looking. It showed up on the X-rays, and you hadn't had X-rays done. So that can also give you a jumping off spot that, yes, I see it on the X-rays now, and it needs to be treated. And the other thing that happens is, and I'm not saying that happened particularly in this case, but um, particularly if I've had patients who change medications, and all of a sudden they've got dry mouth, and things that were going along fine for a lot of years, all of a sudden things go downhill really fast. And it's easy to say, well, the previous dentist missed all this, and maybe something has changed with that patient's health or their diet. They discovered that Werther's original butterscotch is the best thing since sliced bread. So, situation, see, Seth agrees. So, it depends. Things do change for the patient that may have precipitated that. But in some ways, you're fortunate that there was a long span when there's no x-rays, because that gives you your easy out. This would only have been visible on x-rays, and now we have x-rays and now I can see it, which is true, more or less.
I have the queue.
And
I have Jay Friedman in the queue, as well as, and then Dr. King.
Allison.
Let
Allison
Dr.
after that,
King
right?
go. I have to figure out how to get my hand down.
That's a great conversation here about that because we all experience this. I love letting X-rays and intraoral photos do all the talking, and I kind of give the patients a brief tutorial on how to read X-rays and let them figure it out for themselves. Like, oh, radiolucency here, you see the little dark area, and you're really talking at the x-ray, not at them, and not talking about the previous treatment. So I love giving them a simple tutorial on how to read their own x-rays, and they figure it out for themselves in a way. But that's a tricky conversation and a good one we're having here. Thanks, Dat.
Thank you.
Yes. Dan, anything
Jay,
more? Or Jay, are you still have your hand raised? Or you're trying to get it down?
I'm trying to get it
Jay,
down.
Jay, the same way you raised the hand is how you actually lower the hand. I just did it.
So is my hand down now?
You're waving now, actually.
I'm waving now. Great.
That's pretty crazy to be able to do that. That's okay. Anyone else in the queue, and then Gary, back to you, or Linda. No one else.
Gary,
I think we're good.
Gary, you just had rebates.
Yeah, well, actually, and then the other side of the justifiable criticism is if you do have, we have to, the fairness and safety of the patient is the most important thing. If we do have a practice or, a professional, what do you do if you do have a professional that time after time after time, it seems to be, something that, a continual faulty treatment is occurring. I think you do have a responsibility to, report that to the dental society, to somebody. I mean, I think you need to talk to your colleagues about it because that could be an issue. And if you really are caring about the patient, what's best for the patient. If you do have a practitioner that has faulty margins, consistently, something needs to be done. And I want to hear what Linda has to say about that.
Yeah, and the other thing, it could be a symptom of somebody who is impaired as well.
Yeah.
So it's a difficult conversation, but I think also reaching out as a colleague and asking if, is everything okay? Are you feeling good? I've seen a couple of your patients, and the work didn't seem to be up to your usual standards. Is there anything I can do to help you? That kind of thing. And I think Kelsey has her hand raised.
And I just wanted to say, with the podcast that I listened to, they were talking about reaching out to your colleagues, and I just wondered if any of you guys had any tips on doing that as a younger dentist in the field. I don't particularly know a whole lot of my colleagues, and I'm not sure that I feel I have the authority is not quite the right word, but to reach out to someone and say, hey, I'm seeing your patient and I don't necessarily like what I'm seeing and I'm concerned for you. How would you want to receive that kind of information so that it's, comes off as more of a conversation or like a help request and less of an attack on their ability to do dentistry? I know most of us take a lot of pride in our work, and I don't know that anyone particularly enjoys receiving negative criticism of what they've done, whether it's warranted or not.
Jay, did you want to answer that? Looks like Jay has his hand up, so it sounded like he wanted to answer that.
Linda gave a
You're on
fabulous
mute.
example on the social network about maybe you need to see that patient first. I loved your example about the fact that You might run into a patient. I think one of your warning signs is, for me, is when they start coming right in and telling them about the whole litany of all the bad dental experiences that they have had. But until you've actually worked on that patient, maybe even with a rubber dam, you can't get a handpiece in past the first premolar, or they've got to get up every 2 seconds and rinse their mouth out. I mean, some things you just don't know about. So maybe the conversation starter is, oh, I saw your patient today on an emergency basis, and maybe you could give me a little bit of background to help me with this patient, and leave it up to them to explain to you about what's going on. You may be able to read between the lines if there are other issues other than the fact that the patient might be difficult. But I wanted to give her kudos about Linda kudos about what a great example that was, because I have patients like that, that if anybody saw what I had to go through to work on them, and I'm sure we all have patients like that. Now I'm going to try and get my hand down, so you'll excuse me.
Yeah, so that's so the one subject is when something happens occasionally, right? But we're talking more about when it consistently happens. We don't have peer review anymore in Pennsylvania. We used to be able to share something we call peer review, where we could share with other colleagues. But I think it's smart to talk. If you see someone consistently having an issue with whatever it is, then I think it's good to go talk to that person first. And if you don't get a response or a positive response from that person, then you need to talk to other colleagues, in your district or in your leadership or your mentors here, and get some help, because I think we do have a responsibility to protect the public. And if something is going on, we have to get to next steps. And not that I'm trying to disparage another dentist. We don't want to do that. But like I said, only if it's a consistent thing that's been going on for months or, weeks or something, and you're like, whoa, something's not right. Like Linda said, it could be a warning sign of, something else going on. Linda, you want to say anything?
No, I'm good.
All right. And then the last part under justice is dentists shall not accept or tender rebates or split fees. Split fees are like when you make an agreement with a vendor that if they advertise for you and a patient comes in, you'll split the fee with them, give them 10% or 20% of whatever that fee is, and that's absolutely not allowed. That's just bad practice, and it's not fair to the patient, and it's not fair to other people. So that's justice. That's the 4. Sorry if it took too long, Linda, but justice is a very important. They're all important, but extremely important. Jay, you have your hand up again?
No, I'm trying to get it down. Is it down now?
Okay.
Yes.
Thank you. I'm so sorry.
All right, let's go on to the next slide. I think, Linda, you have the next one, veracity.
Yeah, and I do think that the justice is a sticky wicket. That's a difficult row to hoe, and I'm really glad we're having this open discussion. So veracity is the 5th and final one of the principles, and it's really truthfulness. We need to be honest and trustworthy when we talk with our patients. Don't be deceptive. Maintain your intellectual integrity. It's very important to build trust. Without truthfulness, you can't have trust. And without trust, you really can't have a productive doctor-patient relationship. Under this topic, we do touch on false, deceptive, and misleading advertising. And thank you for those who respond on the social network. What I was hoping to, another parallel I was hoping to draw with this code of ethics is that the ADA code of ethics forms the backbone of much of the Dental Practice Act in Pennsylvania, as well as most of the other states in the United States. So that when, again, as I said on the social network, when a dentist posts on social network that they're not an ADA member, so they don't have to pay attention to the code of ethics, well, yes, they do, because the code of ethics undergirds our entire profession, whether you're a member of the ADA, PDA, or not. And again, as an example, from our code of ethics. It talks about being truthful in how you represent your fees, how you collect your fees, how you report to the insurance company, how you advertise your practice, how you announce that you're a specialist or a general practitioner that might have an area of expertise in one particular area of general dentistry. It all goes to truthfulness, and it is all part and parcel of the dental law. So without going into a lot of detail in this particular veracity category, just know that as an ADA member, as a dentist, you are obligated to follow the code, and it will keep you out of trouble with the dental board. And I keep talking about the dental board because for those of you who don't know, I served on the Pennsylvania State Board of Dentistry for 6 years. So I've seen it, and I know what kind of trouble we can, my fellow colleagues can get themselves into. And I am trying to keep you all on the right side of the line. So with that, can we go on to the next slide, Sarah? Okay, Gary, time for some wrap up.
Yeah, so when we were having this discussion about ethics, I brought up to Linda and Seth the ethics checklist that I often use. It came from Norman Vincent Peale, and it's just 3 different levels of when you're making a decision. These are kind of the questions I go through to figure, am I making the right decision or not? So the first level is, and I guess I would call this the lowest level, is it legal? So is it in conflict with membership rules? So we all know that federal law, is higher than state law, higher than bylaws, and then higher than either ADA or PDA or company policies. So, is it in conflict with anything going on, in the State Board of Dentistry or in our bylaws? That's the first, level I go to. And then I go the second level, which is it balanced? Being a Rotarian, that's one of the things that we go through. Is it fair to all concerned? So that's something you have to ask yourself. And does it promote win-win? I'm also a Stephen Covey. I love Stephen Covey, and I really like promoting win-win. I think we should always try to have a win-win situation. So, if I go through those things and I'm like, okay, yeah, still, this seems like an okay thing. The highest level is, how will it make me feel about myself? Will it make me proud? Would I feel good if my family knew about it? Would I feel good if the public knew about it? And if I answer no to any of those things, then maybe I need to go back and rethink, what I'm doing. Is that the right thing to do? Because I think if you can answer all these questions and go through the Norman Vincent Peale checklist, and then use the code of ethics as a background, you'll usually come to the right decision. So, will it make you proud? If it wouldn't make you proud, don't do it. All right, next one. Any questions? Linda, you're up.
Yep. So this is just a little diagram, dental ethics, and it's 5 components. And if we can go on to the next slide, we have a video to wrap up this meeting, hopefully.
Yeah. Each year, CBJA has a contest. For the ASDA students, dental school students, and the winner actually gets $2,500 prize, and the runner-up gets $1,500. And we get quite a few students and universities that participate in it. And every year, CBJA has to go through all the videos. And this 2022, last year's, was so different than any other one that we've ever heard. And I think it was not unanimous, but like out of the 17 votes we have on CBJA, I think this one got like 15 out of 17. It was just really good. Now, I don't know if the video is going to be as good here on GoTo, but you can go to, the YouTube. ADA has a YouTube channel or spot, and you can go to that and you can see it where her mouth and the video lines up a lot better than it does in this. But we'll give it a try. But it's a lot of fun. Go ahead, Sarah, anytime you're ready.
Is gone to swelling, nerves bad, patients yelling. There's trauma to the plenty, lesions dwelling. Your service to the surface, whether drill and filling is their choice, not just your chance of billing. A treatment ruse just to get EUs. Gotta let them choose what they want you to do. Console them too. Do not bend the truth. Ethics code, dude. It's expected of you. Let's talk about autonomy. Don't make a economy. Don't assume cavities. Nope, it'll be bad. So don't push treatment on the but I'm the doctor, I know. I studied hard for this code. It don't matter, I quote, because their body's their own. Update them, let them know. So when they go back to the wrong homes, that's when they consider the information you spoke and make a decision. So add that to your notes. You just might lose yourself without morals or ethics. Expected that you never. You gotta do 5 things, do not let your ego grow. It's professional contact, you can't be so. Now we're committing to these rhymes that we're spitting, to take a pledge of not bidding. No lying, so we're not cheating, but how we're treating. We must show veracity, we can't be scheming, hold truthful meetings, words that are soothing, avoid a lawsuit and no ploys or it's over, not hard to be honest, heart to heart boys, it's a joy to avoid karma, it's their choice, and if no void and alloys in the tooth don't need nada, lies destroy, put the patient before commas, but sound the alarm cause you cannot induce harm, non-maleficence means you gotta pause the trauma. If it's out your scope, refer out and about, no clout and no drama. So the soap note is wrote and it shows you can't use for pharma, and then we treat on MOD and MO. You just might lose yourself without morals or ethics. Expected that you never break the code. You gotta do 5 things, do not let your ego grow. It's professional conduct, you can't be so. One more thing, you better be the most fair. Call me RBG, I love justice, you best beware. Treating everyone with respect, unbiased care. That means no judging, no bystanding, no glaring stares. But you keep hustling and don't be blindsided, cause it's best to be beneficence minded. The patient's best interest you keep in mind. Make sure their goals and yours have aligned. Right after cleaning, show OHI them. Try at your shade, get your drill into the field before giving them whitening. Plan a system recall, cause it's the best timing. Writing these rhymes so that when things get tough, you'll be even tougher, using ethics as your buffer, so that sure enough your conscience won't get stumped and you'll be feeling like a puppet. Never let their less money or production make you feel like you're stuck in one spot. Another day of monotony is haunting me, but nah, you cannot be brought into morals that rot or give away to bad thoughts. The ADA code is the only option, it can't be bought. Look, I respect you, but this is the baseline. Don't care for your patients really ain't a lot, so go ahead, shoot your shot. Give me your best thought, cause this is the most important thing that you're taught.
And so the 2022 ethics video contest winner was Ellie Friedman of the Herman Ostrow School of Dentistry at the University of Southern California. And you know, she based it on Lose Yourself dental ethics parody, and she won $2,500. So it was fun. It was fun. So go to YouTube, or go and check it out. And it was fun. It was fun to watch and listen to, and I think you can learn a lot from that video.
Right. I know we are getting to the 8 o'clock hour here. I have 8:03. Linda, you may have 8:25, but we're going to go with 8:03 for this one. Does anyone have any questions or anything they want to discuss briefly? If you have to go, understandable, but if you want to stick around for a minute, feel free.
I think Charlie in Calcaterra has his hand up.
Yep, I see Charlie.
Your lips are moving, but we can't hear you.
Yeah, you might be muted, Charlie. Well, you're not muted, but I think your microphone might be off a little bit. You could type it into the chat, maybe. Anybody else? I got Dr. King and then Gary.
Okay, this is not about ethics, but if we're kind of going any questions now, I am on the PDA app and I was not getting, this is more of a technical question, I guess. I was not getting our group discussions on the app. I had to find it in my web browser. What am I doing wrong?
I can answer this, Linda.
Okay.
So are you on the social network? You are, because I saw the things come up. If this answers the question, the social network will not show up on the Go app.
Okay, then that answered the question.
Yeah.
I was looking there for some discussions at first, and
I know it's nuanced, but if you can figure it out, and we can help you with this, is you can get alerts, and you may already have them turned on, but you can get alerts through email that you have a
yes,
message on the
got that.
social network. So that's pretty much what you have to rely on for any
Okay,
social network discourse, if you will.
sounds
And
good.
the app, you would rely on your phone giving you the alert, which you can turn on for that as well.
Got it. Thanks.
And then I have word from Charlie here.
Having to
So
do with
Charlie says,
informed consent.
oh yeah, go ahead, Linda.
No, go ahead.
He says,
You
be
can
careful with
comment.
informed consent if you are a general dentist and put yourself out as a, quote, specialist, such as a cosmetic dentist or an implant dentist, which I'm sure you've seen advertised where you are, anybody. I teach that in my lecture to the residents, and that's part of veracity. And Charlie says, I know there was some discussion on that this week. So that was actually a pretty good discussion on the social network. So well said, Charlie.
My question, Seth, is, the CEBJA now is working on issues with AI, and I just wanted to throw that out with people. Or there's dentists are using AI with radiographs, to find decay. So what happens if, I'm just throwing it out there, but what happens if patients get some radiographs and they are able to get some AI, and they put it in their thing, and their treatment plan from the AI, strictly AI, without doing an examination on the patient, comes to be different than what your treatment plan would be. How are you going to handle that?
Mm-hmm. And you should, because for those that don't know, we just had a lecture on it. Charlie was there. We had one of the guys that invented Overjet, which some of you may have heard. So he was in on beta testing Overjet, which is you have X-rays from previous years, and Overjet will tell you where there are now problems, where there's recurrent decay. Overjet will also tell you what percentage of the tooth structure is damaged to where you need a crown or not. In fact, it even goes as far as if you present your Overjet data with your crown submission to an insurance company, they have to accept it. And if they don't, then they are able to be litigated. So fun fact, I'll start up a little conversation about this so I can share it on, I'm a big PDA Go app guy, so I might put it on there. But if anyone wants me to do it on social network or email, we can do that as well. But we just heard them on Thursday, so it's fresh in
So
my
how
memory.
long before patients and non-dentists start getting that software?
Well, I mean, this thing is, first off, it's expensive. It's like a $500 a month fee, and I'm sure they're looking into it and trying to regulate it. But like anything else, Gary, who knows? Someone could jailbreak it, and start using it. I'm not sure. I'm not, a tremendous AI guy. So I just want to let you all know that that's out there. Overjet, look it up. And then I had, I'm just saying this. I know you're not really supposed to call someone out by name, but all of you have heard, I'm sure, of Kenny Wilstead on social media. I highly recommend you start looking at some of his stuff if you want some ethical dilemma conversation going, because he's all over the internet and he's not afraid of anybody. So I would start checking this guy out. And just a fun fact, I sat next to him in dental school, so that's why I know about him pretty well. So I would look him up, and if you want some ethical headaches, check it out.
So I've heard.
Go ahead,
Sorry, Linda.
Allison. No, go ahead.
Back to AI Overjet. I've heard that Delta Dental or some insurances are using AI and replacement of their dentist, do they have to abide by any ethics? Are they just exempt from everything? Or do their actual dentist, when they look at the appeals, do they have to still abide by any ethical code? That should be a whole nother topic of discussion there.
Good question. I think we should discuss this.
Absolutely. Well, and I hope that this little taste of ethics has done a couple of things. Stimulated some really good questions. Feel free to post those on the PDA Go app or on the social network, and we can certainly continue to discuss those in that forum. And I also hope that we've given you a framework or a filter when you're looking at some discussions on social media, and being able to ask yourself when you're looking at responses to questions, yeah, but how does that fit in with our code of ethics? Is that ethical? What's the ethical solution? And maybe give you another lens through which to look at some of these um, questions and answers on social media. Seth, do you have any final thoughts? And I think we're a little over time according to either my watch or my phone, but
No, I think, everyone, thanks for being here. I know this isn't always like the most exciting topic, but this is a really good group, and I learn things from, Gary and Linda every time I'm around them. So thank you for all your insight, and I know you have good CBJA backgrounds, so that definitely helps out. So thank you very much, and thank you everyone for being here. I'll try and fire up a discussion on the Go app, no obligation, but if you want to chime in or
Hey
have
Seth,
questions, we'll go from there. Yeah, Dat.
I like the band face.
You like Bane
Mhm.
masks? Or I got into that ethics video.
That's pretty
Sorry
cool.
I got
That's pretty
got
cool. I
into
like it.
a little much there. I like to have fun, Dat. We're gonna have fun this year, this group. I promise.
I love it.
Yep.
all right, we'll
All right,
We
look
are
forward
everybody.
having
to
fun.
seeing you all at the leadership conference.
Yep. Good night, everybody.